Telehealth nursing. What is telehealth nursing? Over the past decades, the field of nursing has continued to be mobilized with the most recent research, technologies, and methods in hopes of providing the best quality care to patients. Telehealth nursing is a relatively new domain of nursing which involves the use of telecommunication technologies to deliver healthcare services to patients. Telehealth nursing has allowed nurses to provide long-distance care, monitor patients remotely, and provide education on important telecommunication resources. How is telehealth accessed? Technology works together to provide long-distance care and monitoring of patients. Some of these technologies include texting, calling, video conference, interactive links, and even monitoring patient data, like the patient's vital signs, such as checking bodily functions, blood pressure, oxygen levels, and blood glucose levels through software applications. Again, the resources of telehealth accessibility is texting, calling, video conference, and interactive links. Aside from patient-provider access, the significance of telehealth in present-day nursing is shown through cost, convenience, and transportation. Coronavirus disease, also known as COVID-19, played a major role in the realization of importance and the utilization of telehealth. Cost can be a factor in whether or not someone may take steps to improve their health. An online treatment can significantly make this difference. A recent study from the American Hospital Association revealed that patients saved more than $2,700 when opting for telehealth physical therapy instead of in-person treatment. It provides patients convenience by being in the comfort of their own home and reduces wait times. For example, without telehealth, a patient may need to drive across town to get a physical examination done. But with telehealth, they would be able to receive the same treatments without using time to commute. Patients are able to stay at home when sick, which also prevents spreading illness or disease. The need to travel is dismissed by telehealth. Transportation should not be a routine issue. Telehealth was originally created to provide care to patients with limited to no access to healthcare. Hospitals were under pressure from communities to make the quality and costs fair for patients. Telehealth was seen as an accomplishment for allowing this. The three main significances are cost, convenience, and transportation. Despite the advantages of telehealth nursing, there are some considerable limitations that have posed both ethical and legal issues. Limitations in telehealth nursing include a possible lack of accessibility to these tools, patient-provider relationships, and patient privacy. The inability of providers to be able to complete everything that they would be able to in physical examinations, non-tech savvy persons or an older generation's ability to use online services, and inaccessible internet or technology are all issues regarding lack of accessibility. Another worry includes the effects that telehealth may have on patient-provider relationships. Reading each other's body language is limited. This may affect the relationship dynamic and trust given. So again, limitations are physical examinations and connectedness between patients and providers. Legal issues. The impact of telehealth nursing on patient protection and privacy is a legal issue. Telehealth nursing is newer in healthcare. Therefore, there are not many regulations implemented yet. There is also a risk of third parties having access to patient information and violating HIPAA laws. Although most telehealth services are highly encrypted and monitored, no program is completely hack-free. Nurse licensure could also present legal problems across state lines since nurse practitioners face more state regulation. Lastly, medical liability is always a possibility through unclear directions and not living up to nursing standards or protocol via online. Ethical issues. The use of telehealth in nursing has also posed some ethical issues. For example, when caring for the patient, physical assessment play a key role in identifying the symptoms that a patient may suffer from. This can also help to encourage intervention early on, along with possible prevention methods. However, through telehealth, the nurse is unable to see the patient face to face and must rely on the patient's self-reporting of their symptoms. Autonomy and professional duty may be infringed upon. It may be unethical for the nurse to not adequately care for the patient in this sense. The provisions of the Code of Ethics for Nursing are the standards that nurses must follow, including the measures they will go to for their patients. Provision 2 states, the nurse's primary commitment is to the patient, whether an individual, family, group, community, or population. With the development of telehealth, it allows nurses to communicate and spend more time with their patients. With everything being online, patients do not need to be in a physical hospital to receive care. Everything is easily accessible. Patients are in the comfort of their own homes, so this may allow them to open up to their providers more. This is important to nurses because it gives them more insight as to what the patient's current health conditions are and thus allows them to provide the best care they can. Additionally, patients' care of telehealth sets many goals and guidelines in place, which will call for the nurse to make important decisions. Provision 3 articulates, the nurse promotes, advocates for, and protects the rights, health, and safety of the patient. As telehealth is still a new and progressing concept, nurses are limited in terms of how they can help their patients. Nurses can communicate with patients through video or phone call, but are not able to perform physical examinations or run labs. A main priority for nurses dealing with this barrier is to educate their patients. Provision 6 specifies, the nurse through individual and collective effort establishes, maintains, and improves the ethical environment of the work setting and conditions of employment that are conducive to safe, quality healthcare. As nurses primarily use education-based practices, they are continuously looking for new technology and research to improve the care of patients. Additionally, it is important for the nurse to maintain a professional environment that places emphasis on the patient's wellness. The ethical principle of beneficence states that the nurse must show sympathy and kindness towards the patient. By listening to the patient and allowing them to speak and voice their concerns, this helps them to feel safe and secure. It is also important for the nurse to maintain eye contact with the patient as they speak to show interest and engagement. By making sure that every need is addressed, this will demonstrate strong health advocacy for the patient. It is also important for the nurse to deliver proper education to the patient in regards to the different aspects of telehealth, with the main goal of protecting their privacy and ensuring that they receive the highest quality care. The ethical principle of fidelity involves being loyal and honest towards the patient. Fidelity also requires the nurse to keep any promises that are made to the patient and to uphold their responsibilities as a nurse. In telehealth nursing, it is important for the nurse to keep patient privacy and data confidential. Every decision that the nurse makes should also work towards improving patient outcomes. In conclusion, we think that telehealth nursing is extremely important to have, especially as an option in relation to in-person services. Some key technologies that have been used for telehealth are mostly easily accessible. including applications ready to download, as well as text, call, and video chat that are already on modern phones. The only issue is that not everyone may have access to phones or the internet. Telehealth care reduces cost and time travel, which may be the reason someone commits to maintaining their health. In turn, telehealth nursing access improves health outcomes.